Today we're doing a cerebrospinal fluid collection on a boxer dog who we suspect has neurological disease. He's already had x-rays done, and now we're just about to collect the fluid that bathes the spinal cord and the brain in order that we can determine if there's any inflammation or infection likely to be present. This is important before we start him on treatments which might be immunosuppressive, and also to guide us in case there is in fact infection that we need to treat specifically. Now the needle's inserted using very specific landmarks on the body. I've got my left hand on the wings of the first cervical vertebra, and I've got my right middle finger on the occipital crest, and I'm using those landmarks to guide the needle. I've got a nurse holding the head to keep it perfectly straight and central, and I'm aiming at something called the cisterna magna. I've taken the stellate out of the needle, and now I'm advancing it carefully until I puncture the cisterna magna and cerebrospinal fluid will flow from the needle. It's a difficult procedure, sometimes only at referral level, but I've done lots of these and I'm very confident doing them. It's a matter of just being very careful, having really good positioning to get this right.
Okay.
Now here comes the fluid. I'll let the first few drops go, so just to get rid of the blood contamination.
I got it.
And now we're going to collect those, first time in a sterile tube, and this is for culture in case there is something growing in there.
Sample.
And the second, in a minute, will be for the cellular analysis, to got a pathologist to look at and determine if there are abnormal cells or abnormal populations of inflammatory cells. And this is the EDTA tube now. This will, of course, be read by a pathologist, and a report's already back on this. It came back this evening, showing that we have perfectly normal cerebrospinal fluid. We've made a tentative diagnosis in this dog of an immune-mediated arthritis rather than a spinal or brain-based disease, which is a much better outcome for this dog. We're going to put him on treatment tonight, and we expect him to improve fairly quickly over the next few days, and we'll reevaluate him in a week. We've got enough fluid now, out comes the needle, and we're going to wake him up from his anaesthetic.